Hi, my name is Daniel, and I'm going to be doing the IS competency, or the incentive spirometer. So I would get an order for the incentive spirometer. So I would get the order, I would check, I would look up the patient, see why it was ordered. Typically it's going to be for post-op, so someone just got out of surgery, they're going to be in bed for a while. So we want to give them the incentive spirometer to keep their airways open and everything. It can also be used to reverse atelectasis, but typically it's going to be used to prevent it, and like I said, in post-op patients. So I could also check the patient's background and all that kinds of stuff, any past medical problems. The equipment I would need is my stethoscope and pulse ox to get the vitals. And other than that, the IS. This would usually come in a package, already wrapped. So when I'm looking up the patient, I would get my IS, open it up, take this chart out. On the back, it has the predicted volumes for people. So the predicted volumes go off of three things: the gender, the height, and the age. So I have a male patient, 5'7", so they would be 67 inches tall, so I would round up to the 68, and 23 years old, so I would round up again to the 25. So then I would just come this way, meet in the middle, and I would find my predicted value of 3,200. So I can circle that before I get to the patient's room, and after that I'm ready. So I go to the patient's room, and knock, knock, knock.
Come in.
Hello, Mr. Jeanette. My name is Daniel. I'm a student, respiratory student with Hartnell. I'm here to give you your IS. Is that okay?
Okay.
All right. Can I get your full name and your date of birth, please?
Taylor Jeanette, September 29, 92.
Okay. And can I also just take a look at your wrist? Okay. So I have my patient identifiers. So before I get into this, I'm just going to take your vitals, okay?
Okay.
All right. I'm just going to put this on your finger. Just going to tell me your oxygenation and your heart rate. Just going to make sure that your pulse matches up with what I see on the screen. Okay. And I'm just going to get your breath sounds, okay?
Okay.
You can just roll to your side for me. Roll that way, please. Thank you. All right. And just take a deep breath in, okay?
Okay.
Good. Again. And again. All right. Go ahead and lay back down. And I'm just going to listen to the front, okay?
Okay.
Go ahead and put your arm down. All right. Deep breath in. And again. All right. We're almost done. Two more. That's it. So have you ever used one of these before?
No.
No? All right. Before I get started, I'm just going to confirm a couple things with you. You are 5'7"?
Mm-hmm.
Okay, and you are 23 years old?
Yes.
Okay. So now what I could do is I could take a marker. I already had my predicted value, so I already checked that out. So now I could take a marker, and I could actually mark 3,200 on here, because even though it has this little needle, if someone isn't paying attention and they move it or something, they could move it. And then when the patient goes back to use it again, this is in a different spot, so you could just mark the target volume with the marker. So I'm going to be giving you the IS because you just had surgery and you're going to be in bed for a while. So you're going to be in bed and you're not going to be getting up, you're not going to be walking around all that much. You're pretty much just going to be laying there. And when you're laying there, you're going to be taking shallower breaths. And when you're taking those shallow breaths, what we're trying to prevent is collapse of your alveoli. Now they're responsible for gas exchange, but if you think of like grapes, when you go and buy grapes, how all the grapes are on a stem and then they go to a bigger stem. Those are like what your airways are like. So your air is coming down this way and then they go into the grapes, and that's where the gas exchange happens. And you've seen a grape, they're nice and they're full, and then you've seen a raisin. We're trying to prevent atelectasis. And what atelectasis is your alveoli, which are responsible for that gas exchange, they start to look like those raisins. So not as much air is getting in there, there's not as much gas exchange happening. You're not gonna feel as well, you're not gonna be oxygenating as well. So what we're trying to do is we're trying to prevent that, and we're trying to keep your alveoli open, like grapes. And by keeping those open, you're gonna oxygenate better, you're gonna feel better, you're gonna recover a little quicker, you're gonna be getting up and moving around, and it's just gonna help you, all right?
Okay.
You got any questions or anything?
No.
No? All right, now, when you do this, it's not really gonna hurt. You might get a little lightheaded or something. Not really much is gonna happen. It's just deep breathing exercises. So really all you're doing is you're just gonna exhale like you normally would. So just a normal, and then you're gonna grab this, you're gonna make a nice seal on the mouthpiece, and then from that exhalation, you're just gonna breathe in. Now I marked 3,200 because that's your target volume. So you wanna get up to about right here. So like I said, all you're gonna do is just a normal exhale. You're gonna make the seal. You're gonna breathe in. You're gonna breathe in as far as you can. And you wanna try and get up to your marker. When you get there, you're gonna hold your breath for about 3 to 5 seconds. So that way it's helping to stretch it out, and you're not just breathing in and letting it go, but you're actually keeping them nice and open. You're giving them a little stretch. When you do breathe in, there's these 2 little arrows right here. So you don't wanna breathe in too fast because this thing, it's gonna jump past the top arrow. So if it jumps and it's above that arrow, you're breathing in too fast. And if you're not even making it to the bottom one, then you're breathing in too slow. So you wanna keep this right in between the 2 arrows. Again, a breath hold when you get all the way up, and just a normal exhalation. You don't have to empty it all out, just, okay? You think you can do that?
Yeah.
Okay, we're just gonna do a few right now, okay?
Okay.
So right now what you would be paying attention for is you would wanna mark the patient's best inspiratory effort, so that way you can chart it later. Patient got to about 1750, so I've, just take a little break. I don't want you to get lightheaded or anything. Whenever you're ready, just go ahead and go again. All right, that's good, that's good. Keep going, keep going, keep going, keep going, keep going. All right, that one was better. We want to try and get better every single time we do it, okay? Because you're getting more of those airways open, so we want to see a better effort each time. We want to see a higher number each time, okay? All right. Whenever you're ready. Keep going, keep going, keep going, keep going. Go, 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 go. All right, that was a good one. We're gonna do just one more, all right? Like I said, just take your time, no rush. Alright. Try and get to that 2,500, okay? Try and get to the 2,500. No?
With it.
Oh, I'm sorry. Alright, that was good though. You got to
It hurts right
2,250. It hurts?
Mhm.
Okay, if it hurts, what we can do, I can go grab you another pillow.
Okay.
What we can do is, it's called splinting, so you would just hold that pillow to your side, and then you would just squeeze on it while you're doing this, okay?
Okay.
So that's one thing we can do. Again, I just wanted you to do a few right now, make sure that you know how to do it.
Okay.
When I leave, what I want you to do is I want you to do 5 to 10 deep breaths an hour. And I know that sounds like a lot, but if you're watching TV or something, when the commercial comes on, just go ahead and do 1 or 2.
Okay.
If you're reading a book or something, every few pages, just go ahead and take another 1 or 2 of those deep breaths, and just try to get 5 to 10 in an hour. Like I said, I know it sounds like a lot, but it's just deep breathing, you know. So it's all on patient effort, and it's all up to you. So it's up to you to keep it up, and it's up to you how far you go. And again, we want to see a higher number each time you do it, and that's going to help you get out of bed faster and start walking around and get out of here faster, okay?
Okay.
All right, so I'm just going to take your vitals again. Just going to check your pulse again and make sure that it matches up. All right. And I'm just going to listen to your breath sounds. All right, remember, deep breaths for me, okay?
Okay.
All right, go ahead. All right, go ahead and lay back. And I'm just going to check the front.
Okay.
Two more. All right. And that's it. You have any questions? Anything I can get you? Anything you need?
Not so far.
No?
Yeah.
All right. Well, again, my name is Daniel. If you need anything, go ahead and just call back. Just press the nurse button. Just tell them you like respiratory. Again, my name's Daniel, and that's it.
All right. Thank you.
So I could throw away the gloves, wash my hands or alcohol again, and I would go chart. So I would chart the pre-vitals and the post-vitals. The breath sounds, if there was any atelectasis or anything the first time, I would have heard it in the bases, and it would have been like a crackling sound. So after doing some of that deep breathing, we would be hoping for no more crackling, or at least less crackling, and that would be, you know, a good response, a good patient response. If the patient didn't respond, we would need to be more aggressive with our lung expansion, so we could jump to something maybe like EasyPAP or IPPB, and that's it.